Welcome to this video on sudden cardiac arrest in athletes, presented by MedStar Health. Cardiac arrest occurs when the heart stops beating. This can happen because the electrical signal to the heart is disrupted or because the heart muscle stops pumping. In adult patients, including athletes, cardiac arrest is usually a result of cardiovascular disease and risk factors, including diabetes, hypertension, obesity, tobacco use, and family history. However, young athletes with none of these risk factors may suffer cardiac arrest as well. Some of these athletes have an inherited condition that they didn't know about that causes abnormal heart structure or abnormal heart rhythms. Most of these athletes will have no warning signs or symptoms before they collapse and sustain a cardiac arrest. There is also a very rare form of cardiac arrest that can occur in young people who sustain a high velocity and very focused trauma to the chest, such as getting struck by a lacrosse ball, a baseball, or a karate kick. If this impact occurs at a specific moment in the electrical rhythm of the heartbeat that interrupts the electrical impulse to the heart muscle, it can send the heart into cardiac arrest. Recognizing cardiac arrest in athletes may not be as simple as it seems. Athletes usually collapse, often without contact with another player. They may sit first or slump to the ground, without putting their hands out to protect themselves, often hitting their head or face. You may see them gasping, struggling to breathe, or having twitching movements that look a bit like a seizure. If you see this, immediately run to the patient and see if they are responsive. Ask, "Are you okay?" and tap them on the shoulder. If they do not respond, ask someone to call 911. Begin CPR and send someone to get an AED, which is a defibrillator that evaluates the heart rhythm and helps shock it back into a normal rhythm if needed. Every minute without defibrillation increases the risk of death by 7 to 10%.
Every athlete in America is talking about using CPR and AEDs to save lives. I head up athlete rehabilitation for the Mystics, and I know CPR. Dr. Alex Koo from MedStar Health is here to show us what to do in about 3 minutes.
Yeah, it's super important. Did you know women and Black and Hispanic adults are less likely to get CPR from a bystander? You don't need to be certified, and you don't need to do mouth to mouth.
All right, let's get started.
If you see someone who has suddenly collapsed, is unconscious, not responding, not breathing, or is gasping for air, first assess their need for CPR. Hello, ma'am.
Are you okay?
She didn't respond. She needs CPR right away. Next, you assign someone nearby, or you can do it yourself to call 911 and someone to get an AED. Have the phone on speaker so you can hear. Next, you start compressions. Kala, would you like to demonstrate?
Sure. Lock your fingers, place the heel of your hands on the bottom of the breastbone. Compression should be fast and about 2 inches deep. Let your hands come almost all the way up between compressions. Keep your arms straight. All of the work is from your upper body. Think of that song by the Bee Gees, Staying Alive. That will give you about 120 compressions per minute.
You can't hurt them. Their heart has stopped. They're not feeling any pain. If we don't get the heart restarted, they're going to die. Again, there's no need for mouth to mouth.
The good news is all states and the District of Columbia have Good Samaritan laws to protect bystanders when they try to help people in distress.
The AED has arrived. Take off the shirt, open up the machine, turn it on, and it will tell you exactly what to do. It's super easy.
Apply pads to patient's bare chest.
Just like the picture.
Plug in pads connector next to flashing light.
Just listen to what it says to do.
Analyzing heart rhythm. Do not touch the patient. Shock advised. Charging. Stay clear of patient. Deliver shock now. Shock delivered. Paused. Begin CPR.
You keep going until help arrives. I hope you can see how easy this is. We can all do this.
Come on, let's team up to save lives.